to feel free to put that on the chat, and we will answer that for you as our talk goes on or towards the end. So,
first of all, can everyone just hear us okay? So just in case, let us know if there's any problems at all.
Absolutely.
Yeah? Okay.
So just an overview of our agenda for today then. So first of all, we want to have a chat about what is a migraine exactly? What are the symptoms of a migraine, the cause of a migraine? And then we want to move on to the treatment in the Western medicine perspective of migraines. What kind of self-care things we can do for ourselves and lifestyle changes that we can do. And then we want to talk about some newer medicines that's out there, different treatments. And then Lily's going to take over and have a chat to us about the Chinese medicine perspective in managing migraines. And then we will have a Q&A session towards the end. So first of all, what is a migraine? So if we ask the general public, what is a migraine? Actually, a lot of people might say, or use migraine as a term to say, well, it is a really bad headache or the worst headache that I've ever had, and we'll call it a migraine. However, it's more than that. So a migraine is a neurological condition where the brain has increased sensitivity to sensory information around us. And for migraine sufferers, we know that it is not just a headache. It has a lot of other associated symptoms that can be really debilitating. It's a really important health condition. It's the third most common health condition in the world and in the UK. So medical conditions that we always hear about, like diabetes, asthma, epilepsy. So in fact, migraine is more common than these medical conditions. 1 in 4 adults aged 15 to 49 in the UK are living with migraines, and it is 2 to 3 times more common in women than men, most likely because of the hormonal aspects that's linked to migraines. And a lot of people may start developing migraines in their adulthood, and it might get a bit better as we get a bit older. It certainly can be a really disabling condition and a real burden to individuals with migraines. So it can affect their daily life, it can affect childcare, your work, your social life, in terms of your even doing housework. And it can certainly have an impact on perhaps your relationship with your friends, family, your spouse. And it's also known to link to mental health problems like anxiety and depression. So it is a really important condition. Now, I want to talk a little bit about the migraine brain. So the migraine brain, also, there's a theory that it functions slightly different to people who don't have migraines. So migraine brain is really more sensitive to normal life events. It has a lower threshold to develop migraine compared to others. So this threshold that we're talking about is where threshold to various triggers around us. So we call it different life events. And so, for example, these triggers can be stress, it can be hormonal changes, it can be changes in your sleep pattern, dehydration, so environmental factors, and your diet. So if we just have a quick look at that graph underneath there, so where the dotted line is where we can think of it as a migraine threshold for the migraine brain, for migraine sufferers. So beneath there are different triggers. So for example, staying up late, stressful day, or changes in the meal pattern, as it hits that threshold, you will develop a migraine. So, but in people who don't have migraines, that threshold is much higher than someone who does have migraine. And these thresholds can change throughout your life as a migraine sufferer. So what are the symptoms of a migraine? So I want to talk about sort of typical symptoms first. So when we say the typical symptoms of a migraine, it's usually described as attacks of moderate to severe headaches. So usually it's described as headaches on one side, a throbbing type of headache, pulsating type of headache, and it can last 4 to 72 hours. But we need to bear in mind that this doesn't fit with all migraines. So there are migraines which will happen so you get pain on both sides of your head, and there are migraines that can last over 72 hours. So not all migraines will fit into this typical description. And you can have associated symptoms such as you're sensitive to the light, sensitive to sound. So people with migraine, when they get an acute migraine, that's why they want to go and sit in a dark and quiet room to avoid these associated symptoms. You might feel sick, you might even be sick, you might feel very dizzy, you might get a bit of vertigo, you might get a lot of fatigue and also reducing concentration. So the headache itself may not be the most bothersome symptom for you. It could be, for example, the fatigue that you get from it. Now, 25% of migraine sufferers will also get what we call auras. So auras are transient, so focal neurological symptoms that can come before a migraine. So they can last from 15 minutes to an hour. And bearing in mind, although 25% of migraine sufferers get these, they won't get an aura with all their migraines. So the most common aura is visual auras. So where you get visual changes. So you can see perhaps zigzag lines in your vision, a blind spot, of course, scotoma. You may see flashes of light. So the most common one that I see where patients tell me about are where they see the blind spot. So they may see almost like a crescent in the peripheral of their vision, like in this picture you see on the slide, where they can't really see past it, and then they may see sort of bright colors around that this blind spot. But you may also get, so auras may also be sensory symptoms. You may get pins and needles on the side of the face or on your one side of your arm, even some changes in your motor function, like some weakness and changes in your speech. So they can be quite frightening, these aura symptoms, if you've never had them before, because they might mimic symptoms of other neurological conditions. So if you have any questions, certainly, and unsure, certainly speak to your doctor about them. And I just want to mention some other types of migraine, like vestibular migraine, you might have heard of, where people's main symptoms are really severe vertigo, abdominal migraines. So this is more common in children where they get stomach aches. And as they get a little bit older, they may develop develop into migraines. Hemiplegic migraine, which really affects the motor function. So causes of migraine. So actually, we don't really know the exact pathophysiological cause of migraine. It's not fully understood, but there's definitely a genetic component to it. So if your mom or dad or in your family, there's a family history of migraines, so unfortunately, you are more prone to getting migraines. And we do know there are common migraine triggers, like we talked about the threshold theory earlier. So stress, sort of busy lives, any changes in your life, or work pattern. Hormones is a really big one. So for women especially, you may get migraines associated with a migraine, so menstrual cycle. During the perimenopause or menopause period, there may be changes there. Also with pregnancy. I mean, interestingly, women during pregnancy, a lot of the migraines actually improve, but in the postnatal period, they can aggravate again. So any changes in your meal pattern, even the weather, so thundery weather might actually trigger migraines. Any smells or perfume, and any changes in and any specific dietary triggers as well. So basically, overall, so anything out of the routine can be a trigger for a migraine sufferer. So migraine brain really likes routine. So a little bit about diagnosis. So when we see someone coming in with a headache, so we will basically take a really full and detailed history. We will ask you about your characters of your migraine, the duration of your migraines. We put it all together, and usually from the history and an examination, but mainly from the history, we can diagnose the migraine. We will rule out other causes of a headache. So the common types of headaches you may hear about are tension headaches, so sinus infections and cluster headaches, maybe less common, that one. Any referred pain from the neck and the head, muscular strains that can cause headaches, trigeminal neuralgia. And then as doctors, we also think about red flags. So red flags are symptoms and signs that could indicate something underlying that's more serious. So there are perhaps some, for example, symptoms like any cognitive impairment, any fever, neck stiffness, any really new onset headaches, especially if they have started at an older age, any recent head traumas, vomiting, etc. In which case, then obviously further investigations will be needed. Now, on to treatment. So now, if you have an acute migraine coming on, of course, you want to get rid of it as soon as possible. So now we're going to talk about the drugs treatment. Now, first of all, we talk about the acute pharmacological treatment first. So these actually, they are medications you want to take as you get a headache, so acute treatment. And you can see that we're talking about medication like paracetamols, anti-inflammatories like ibuprofen, aspirin, and triptans. And actually, a lot of these you can get over the counter from the pharmacist. So, and I just want to share with you some useful tips for managing the migraines acutely. Now, so it's really important to take these medications early. So you want to take it at a stage where the headache is building up. So not when it's really severe. So just as it's building up is when it's most effective. So if you do get auras, you take it at the stage where it's an aura, it is a bit too early. So you want to take it after the aura. You want to take these medications at a high dose right at the beginning. So we're talking about high doses of paracetamol, like 1,000 milligrams there. If you're taking ibuprofen, we're talking about 600 milligrams, and aspirin. So we're up to 900 milligrams of aspirin. So, and then also, of course, the triptans. So triptans, they are good medication for migraines. Now, there are 7 different types of triptans. So if you find one that doesn't work so well for you, speak to your GP, try another one. They do have different duration of actions, and some might work better for you than others. You can also combine the treatments together. So for example, you can take ibuprofen and a triptan together. You can also use some anti-sickness tablets, especially if your migraines associated with nausea and vomiting. So there's tablets like prochlorperazine. So you can get over the counter, you can get Stemetil, which is a anti-sickness tablet that goes under your lip. So you can also buy that. Metoclopramide works quite well, as well as them being good for the nausea side of headaches. They're actually also quite good for the pain itself. Now, there's also this triple therapy. So we know that this actually works really well for, to control migraines. So triple therapy, when we talk about combining a triptan, high dose of soluble aspirin, or naproxen, which is an anti-inflammatory, plus an antiemetic. So that is something that you can consider. Onto something called medication overuse headaches, which is really important for everyone. So basically, we were talking about acute medicines when you have a migraine. So if you take too many acute medicines, that can actually cause a headache. So and lower the migraine threshold. So we always advise that you do not want to take acute treatment more than 8 to 10 days a month, and really choose when you take them. For example, don't take them too early. And we know that medications such as cocodamol, tramadol, these opiates, are more likely to cause medication overuse headaches. So we need to think about this condition. Now, so onto the preventative treatments, a little bit tagging on what Lily was talking about in terms of prevention. So we want to think about prevention treatment if you are getting more than 4 migraines a month. And the common medications that you may have heard of is propranolol, topiramate. Topiramate, we need to be a bit careful in childbearing age women because they can have an effect on the fetus. Amitriptyline, nortriptyline, and candesartan. And the main take-home message for preventative treatment is that we need to be patient with them. We need to give it time. You need to start at a low dose and we'll build up. And usually at that dose, it can take 2 to 3 months for the effectiveness to fully come on. So, and we want to use the lowest dose with the maximum effectiveness that you can tolerate. But we need to remember as well that medications are not a cure, so actually achieving 50% of improvement of your symptoms is actually quite a good response. Now, just a little bit about self-care and other tips. So we don't want to be, I mean, hopefully taking too many medications. We want to look at other alternative treatments. So the first one is headache diaries. The headache diaries are really helpful in helping you track when you're getting these headaches, how often you're needing your medications for, and what kind of associated symptoms that you have, especially to help you identify your triggers to try and avoid them or make them less common for you. Also, we need to address any mental health problems such as anxiety, stress, and you can use techniques such as mindfulness, cognitive behavioral therapy. If you're someone who has sleep problems, you can think about addressing that. And Sleepio is a very good cognitive behavioral therapy sleep that based on sleep that is available for you. Think about acupuncture, which Lily has spoken to us about. And then there are also some supplements that has some evidence that they may help you for your migraine. So there's no harm trying them for a few months to see if they help. So they are riboflavin, which is vitamin B12, which is taken 400 milligrams once a day. It's magnesium, 400 to 600 milligrams per day, and coenzyme Q10 at 150 milligrams once a day. So finally, just want to talk a little bit about newer treatments that's out there, newer medications and other form of treatments. So back to in terms of the acute medication, first of all, for when you get that acute headache. So just briefly, I want to just mention the calcitonin gene-related peptide. So this CGRP is basically it's a nerve chemical that can transmit pain during a migraine that's released by the cerebral nerves and the blood vessels, so ramaglipans, and so they can be really helpful in terms of helping with acute migraines. It is available on the NHS. But there are some strict criteria. For example, you would have had to try 3 different triptans and it's not been effective, or if you've got strong contraindications for taking triptans, for example, mainly cardiovascular risk factors. So this is something you could consider asking your GP if you have tried a lot of different methods. And then in terms of prevention, so you may have heard of Botox, and that's been used for quite a long time now. Greater occipital nerve blocks. So these will be all done in hospitals or in specialist headache clinics. And then, so the other one, the newer medications are again based on the CGRP. So CGRP monoclonal antibodies. So they antibodies against the CGRP chemical. So they're offered as injections, so usually once a month. So and I think in some areas, so the NHS may be able to offer them, again, only in hospitals and in specialist headache clinics. So, but again, they can be very effective for people, but you may have to have tried certainly different other prevention methods first before this will be discussed with you. So the CGRP receptor blockers, ramaglipans, so they can, as well as used as an acute medication, can also be used as a prevention, so where it's taken more regularly. And then there are some devices like this Kefali device here that you can see on the bottom left. So they work as almost like a TENS machine for the nerves around the brain. So you can there's little evidence for them actually, but you're welcome to, so that you can buy them and you can try them to see if it helps your headaches. So right, yeah, this concludes my part of the talk. And Lily has shared lots of really good information with us as well for Chinese medicine. So
Thank you, Claire. I remember when we went through this, this was definitely for me as well. So one of the really, really interesting slides. So the others I'm a bit more familiar with, but I was like, oh, this is so interesting. And also, you mentioned about obviously, so some of it may be available in the NHS.
Yes.
But depends on locality.
Yes, depends on locality. The acute treatments, so the GPANs, so they are available in primary care, but certainly you need to fulfill certain criteria before that can be prescribed to you. But so the CGRP monoclonal antibodies, that you will have to be referred for this under the NHS, and maybe more likely to have them privately.
Yeah. With regards to my approach to migraines, and I work as an acupuncturist as well as a Chinese medicine practitioner. We look at migraines, we look at acute pain in a specific way in Chinese medicine. And when it comes to the way that Chinese medicine practitioners treat migraines, first of all, we look at it in terms of the acute pain, the migraine itself, but also we talk about treatment in terms of preventative as well. And that's not entirely different from what sort of Claire was going to be talking about with regards to treatment. When it comes to acute pain, in Chinese medicine, we typically talk about it as a circulation issue. Some of you might have heard about energy that we refer to in the body called qi. And in terms of migraines, we'll often talk about it becoming stuck. So if a person was coming to me for treatment with a migraine at the time of their appointment, then that sort of acute stage of treatment would typically involve releasing and moving the energy, the qi. And that can be done in a number of different ways. Typically in the clinic, we'll be doing that with acupuncture. Sometimes there are other modalities that we'll also use, which I'll talk a little bit about later on as well. In terms of preventative treatment, this is probably where Chinese medicine offers the best kind of value, if you like, because for some of my patients in particular, you know, they may be getting a migraine once a month or once every couple of months. So really, it's not necessarily that sort of, you know, that acute stage where they're really often bedridden. They're not able to leave the house because they are so fatigued and in so much pain. So taking, seeing an acupuncturist at that particular time isn't always feasible. So really the value that we add to the whole treatment regimen really is in trying to prevent them from occurring in the first place. So the way that we approach it really is through improving the body's essentially resilience to those triggers that Claire mentioned. So a lot of it in my own migraine patients are it involves stress, physical tension, changes in routine or diet, which were mentioned as well. But essentially those, the threshold sort of graph, that diagram that Claire shared just a moment ago, essentially is about improving that threshold so that you feel like actually your body can take on more stress than it currently can do as a migraine sufferer. So a lot of it is about sort of building that up very gradually, but also having those very sort of focused conversations with a healthcare professional who can help you identify the range of those triggers and usually sort of work out a bit of a treatment plan with you. So alongside having treatment like acupuncture, it's about also talking through any areas of stress or any sort of things that might be causing physical tension that you can start to do something about as well. So yeah, it's those kind of coaching style conversations which can be really, really helpful. When it comes to acupuncture, so in terms of acupuncture, there's a lot of really good evidence supporting acupuncture for the use of migraines. Sort of tension type headaches is another sort of area that NICE review. So NICE, for those of you who are not UK based, so this is the National Institute for Health and Care Excellence. They are our healthcare body that helps to review the scientific evidence for all kinds of medical treatments for various sort of conditions. And in terms of they look at the cost effectiveness for the NHS and essentially advise the NHS as to whether they should or should not adopt it based on cost effectiveness. So in terms of migraines, acupuncture now has been included in, I believe it's the last 2, maybe 3 iterations of NICE guidelines for migraines and chronic tension type headache. So in adults, this is in relation to there's a recommendation specifically to consider non-pharmacological therapies as an adjunct or perhaps as an alternative to pharmacological therapy, depending on the particular person's situation and their preferences as well. And this includes acupuncture up to 10 sessions over a course of 5 to 8 weeks or so. So that roughly works out to maybe 1, maybe 2 per week, depending on how sort of manageable that is for the patient. So in terms of how and the mechanisms through which acupuncture can work for acute pain. So there's been a lot of scientific evidence regarding the mechanistic action. So what kind of physiological effects acupuncture has on our body. And the most well-known really is its effects on our nervous system, and which is why it's particularly relevant to neurological conditions like migraines, but also other types of chronic pain as well, which involve the nervous system. So it can help in a number of different ways. So first of all, there are local effects. So you'll see a lady here having acupuncture treatment, and you can see that there are some points that are being needled here around the temples. This is a really, really common headache point that we use. I would use it a lot with my migraine patients as well. And what this does is essentially improves the blood flow in the particular area. Remember that I said in the first slide about acute pain being to do with energy that's stuck. So we look at needing a particular area as helping to release that tension. But at a biomedical level, we understand it also to improve blood flow, but also the releasing neurotransmitters, which can help with the way that the brain is processing pain, essentially. The other sort of 2 areas that are relevant to migraines is that it can have an effect on the spinal cord in terms of reducing the nerve pain transmission to the spinal cord, which then normally send signals up to the brain to tell us we're in pain. So one of the things that acupuncture can do is help to dampen these messages, which in a migraine brain, as Claire's already mentioned, we're sort of a little bit more sensitized to feeling pain. So our pain threshold isn't as good. So actually by helping to sort of calm down those messages to the brain, that's one way in which we can either reduce pain, so reduce the severity of migraines, and sometimes reduce then the frequency of migraines as well. And then finally, the brain I've mentioned about helping to alter the brain chemistry so that it can improve pain threshold and also tolerance to pain as well, which in migraine sufferers tends to be sort of a lower pain threshold. When it comes to preventative treatment and acupuncture, so we are often then tailoring the treatments to what that particular person is going through. So a lot of the time, for my kind of patients, they tend to either fall into stress. Sometimes there are dietary triggers, but more often than not, stress tends to be sort of a larger sort of trigger for them, or they can be related to hormones, so often menstrual migraines. I also treat a lot of adolescents actually who are going through exams. So again, stress is a big one, but often you'll find that during exam period, like the last few months or so, there'll often be adolescent girls who are suffering with migraines around this time as well. So this is a really nice time to be starting to kind of really help these girls and these women. But in terms of preventative treatment, what we're looking at doing is helping to calm essentially the sympathetic nervous system, which is the part of the autonomic nervous system, which puts us in fight or flight. So when we are under stress, our bodies are sort of prone to being in this particular stage. And it's helpful, obviously, for very acute stressful situations. But actually, when we're going through quite chronic stress, it becomes it's unhealthy for our bodies. And essentially what we're doing with acupuncture is supporting your body to come back to the other side, the parasympathetic nervous system, where we're encouraging you to your body to consider more to rest and digest, essentially. So, so that's one of the ways in which we can use acupuncture to work more preventatively by reducing your stress and therefore how much strain neurologically you're putting your body through. There's also been sort of a lot of more recent research regarding vagus nerve. It's become sort of very much in the sort of, in the sort of public domain as well, our understanding of the vagus nerve and various elements of our health. One of the key ways that we feel like acupuncture helps with regulating vagal tone essentially is through reducing inflammation. So this can be one of the ways in which, again, we can support migraine sufferers alongside the more sort of physical aspects of releasing muscular tension. So if there are people who feel like actually their neck, their shoulder pain, sometimes there's a lot of jaw tension, especially when people clench their jaws at night, then there can be these different ways in which we sort of help patients reduce that overall kind of, again, strain on the body to stop them from being as prone to developing a migraine. When it comes to Chinese herbal medicines, so in the UK, registered practitioners only prescribe plants as herbal medicine. So we are legally not allowed to use animal products and minerals either. So this is where I sort of stress, please, please, please do use, please go with a registered practitioner essentially. And I'll talk a little bit about how you can find somebody later on as well. But Chinese herbal medicines are prescribed are tailored to the individual. So again, a bit like the acupuncture, we'll usually sort of select different herbs that are relevant. So in an acute sort of scenario, so these are herbal prescriptions that I'll often give patients to take when they have a migraine. And obviously I'm not able to necessarily dispense that straight away for them. But essentially, we're able to choose, select blends, make up blends of herbs. So often they might contain 5 different herbs or maybe 10 different types of herbs, but they will have slightly different actions on the body. So some of them will be analgesic, they're more directly helping to numb the pain. But then there'll be other herbs as well, which may help with inflammation if we feel like that's more relevant to your kind of migraine presentation. Or there may be herbs that help to improve blood circulation and expand the blood vessels, for example. So those will be more relevant to an acute scenario. In terms of preventative treatment, then we are, again, very similar to the acupuncture. What we're doing is looking to improve resilience to stress and anxiety, improve the circulation, but also there's now sort of a really, really good sort of growing body of evidence about how it can support the gut microbiome as well. So it's about trying to understand how herbs are helping patients with migraines. One of the mechanisms through which it might be happening is through the gut microbiome, which when we understand the gut sort of brain axis, it's kind of, it's really quite relevant anyway in terms of how the health of the gut microbiome has an effect on the neurotransmitters that our brain needs in order to have a healthy function. And then finally, if things like menstrual cycles are a known trigger, we tend to use preventative sort of treatment with herbs to regulate hormones. So this is a fire cupping. So I wanted to show a video, but I didn't want to sort of scupper things if the YouTube video didn't work. But here is, hope you can see this. Here's a glass cup. So it looks like a tiny little goldfish bowl for those of you who haven't seen one of those before. But essentially what happens is in practice, so I would take this, I would use a naked flame, which is why it's called a fire cupping. I would use a naked flame, I'd pop it inside, and what that does is it burns the oxygen within the cup itself. I take the fire out, and then I put this onto the body. So usually for migraine sufferers, I'll be treating the shoulder, upper back. So what that does, what that sort of negative sort of vacuum, what that negative suction does is actually it helps to lift those superficial muscle layers and the supporting structures as well. And essentially it's different from a regular massage in that way, because massage you're pressing down, whereas this you're lifting up. And what this can do is create that space for more movement in a particular area, especially if you are prone to tension, but improve the blood and the lymph flow around that particular area as well. It can be really, really helpful for releasing tension, very much immediately. So oftentimes I won't do I won't do more than sort of 10, maybe 15 minutes of cupping. You don't need any more than that, essentially, because it is so effective. So often that will be used in tandem with something like acupuncture. But it can be especially helpful if you are somebody who feels like you hold your tension in your shoulders and your neck and your upper back. So I use it a lot for people who work on the computers a lot, office workers, and especially post-COVID, where everybody now is working from home and not necessarily with an ideal kind of work setup at home compared to when they previously were more office-based. So I use this a lot alongside acupuncture as a kind of a myofascial sort of release technique, and it can be really effective, again, more as a preventative treatment. And then just a couple of, I guess, self-help tips using acupressure for people who want to, consider trying something different, either for themselves or maybe sort of speaking to somebody who suffers from migraines. So this is a particular very, very well-known acupuncture point called large intestine 4, LI4, or Hergel. And what we do is essentially we massage at a pressure point in the back of the hand. And what you do is locate this sort of fleshy part in the web between your thumb and your index finger. And this can be used during a migraine itself to reduce the pain pretty much within a few minutes or so. And you alternate between the two. Obviously, you can only sort of press one at a time. But when you press it down, you should elicit a little bit of a sort of an achy sensation. And that's when you know that you're stimulating the nerve in that particular area. Some patients do use it preventatively. So if they know that they're going to get a headache, probably because it's on the run up, say, to either their period or because they know that there's going to be a really big work presentation and they're likely to have a stress response to it, then sometimes using this almost to relieve the tension prior to it can also be helpful as a more of a preventative measure. The other thing which I really like to talk to patients about is this. So some of you might know this acupressure seasickness wristbands. And essentially and I think Claire, you're back online, aren't you, Claire? But Claire, you were talking about this on your Facebook page, weren't you, for travel sickness? So it was really, really nice to see a bit of Chinese medicine there. But essentially what we do in clinical practice as well, we recommend it as another way to sort of carry on the effects of what we're doing in acupuncture with acupuncture. So these wristbands, they can be bought in on Amazon. It can be bought on sort of the big supermarkets or pharmacies. But essentially, when you pop them on, so what it does is it stimulates a pressure point in the wrist called pericardium 6 or neiguan. And it's most well known, as you may be able to tell, for effects on nausea and vomiting, and hence why they're marketed as seasickness wristbands. It is evidence-backed, it's medication-free, which makes it really, really popular amongst all kinds of people, but especially kids. So it's really sort of helpful to be able to use these for more specifically, if your migraine does lead you to feel nauseous and have vomiting episodes. But also in traditional acupuncture, we do also needle this point for digestive disorders, for sleep problems. So again, if tiredness, if not sleeping is a trigger for you, then this can essentially help with sleep as a way of trying to minimize those migraine attacks and reducing stress and anxiety. So it can be used as an acute sort of measure. So again, popping them on when you have a migraine attack, or as a preventative approach. So again, so similar to the scenario of if you know that you're likely to get a migraine as a result of something coming up, then using these preventatively can be really useful. So this is a really popular one. I would say if you're going to be using it for a specific indication, like for example, for sleep, then I would say try to stay with it for a good maybe 4 or 5 nights or so before sort of giving up on it, because it can take that sort of time to have an impact on things like sleep. But for things like nausea and vomiting, for migraine pain, it can be instant. So it can be within about 10 minutes or so. So do consider just using them for the next episode that you might be getting. So what I want to say next is side effects. So this is another big question that I get asked a lot. So in the hands of experienced practitioners, serious side effects of either having acupuncture or Chinese herb medicines, really, really rare. So some of the sorts of instances where we hear about some of the consequences of having acupuncture or herbal medicines prescribed, it can be down to them being given out by not very experienced practitioners. For example, in the UK, there are some training courses for dry needling, and that might only last a few weekends, for example. Whereas traditionally trained practitioners, they undergo more than 3 years of training, more than sort of 400 supervised clinical hours, and that's the same roughly for Chinese herbal medicine as well. So this means that when you do see an appropriately qualified practitioner, those serious side effects is, in acupuncture terms, it's fewer than 1 in 10,000, which makes it a seriously safe intervention. Whereas some of the milder side effects like minor bleeding and bruising, that does happen between 1% to 10 of acupuncture treatments. So, but those are mostly tolerable. For a lot of people, the benefits of the acupuncture will outweigh sort of any sort of those milder side effects. When it comes to individualized herbs, like the way that we prescribe Chinese herbs in this country, again, they rarely have side effects because those herbs usually are handpicked by your practitioner. So it means that every single herb that's taking up that space in a prescription will have been specifically chosen for you, and the practitioner will understand how it all works together as well to make sure that it's the right sort of blend for you. But when side effects do happen, they tend to be reasonably minor, so gastrointestinal, like bloating or maybe changes to bowel movements, and that tends to happen really for the first 48 hours of you starting a prescription. It's not expected that you'll continue to experience those side effects once you have been on the prescription for more than those couple of days. And then when it comes to getting treatment, finding a practitioner. So some NHS pain clinics, I used to work with a really, really big one in North London in Archway. We did at that point offer acupuncture on the NHS for all kinds of pain, so including migraines. So it is available, but it's patchy. So one of the best things to do is ask your GP, or if you're seeing a pain consultant, check about its availability. Some private health insurance providers will also cover at least part, if not all, of the costs, but there are just individual policy sort of terms and conditions, so just check those terms. But if you're looking for somebody privately, try to go with a practitioner who has been recommended by somebody you know, a family or a friend. And even if they have been recommended, I would urge you to check that they are registered with a professional body. So usually they will detail that on their literature, on their website. But what I would do is just go back onto the professional body that they say that they're registered with. And these are 3 of the most common ones: British Acupuncture Council, Register of Chinese Herbal Medicine, and the Association of Traditional Chinese Medicine. Go onto those registers and make sure that they are on those registers as well, just so that you can double check they're still, obviously their registration is still valid. This is not an exhaustive list of professional bodies. So there are excellent practitioners who are registered with other professional bodies, but these are the 3 largest ones. And what I'll do is there's a link at the end of this presentation as well, so that you can sort of go onto those registers if you're interested in finding out more. But one of the things that we do in practice nowadays, most of us offer a free 15-minute kind of initial consultation prior to booking. So kind of make the most of it. Get in touch, try to get them on the phone and use it to ask about their experience, how many sessions they think you'll need, and whether they've got specific experience with treating your kind of presentation. And that's it for me. And I do have a couple of slides left just to show you the resources and our contact details as well. These are just to say, feel free to get in touch if any of you've got questions or comments about what we have presented on. There's also a resources and further reading with some of the links and further help as well.
I hope you have all enjoyed it and take something away from it. And yeah, feel free to contact us if you have any other questions that you haven't thought of at this time.
Thank you so much, everyone, for joining us.
Thank you so much for joining. Take care then.
Take care. Bye bye.